Many seniors take medications every day, trusting they are safe and necessary. But according to a veteran heart surgeon, some of these common pills silently damage the heart. Fatigue, irregular heartbeats, and rising blood pressure often go unnoticed until it's too late. These effects build up gradually, making early awareness and monitoring essential. The danger lies in the subtlety. No dramatic symptoms, just slow, hidden harm. Older adults may think tiredness or shortness of breath is just aging, not a medication side effect. This misinterpretation delays action, allowing heart complications to develop unnoticed. By the time they're diagnosed, the damage may already be serious or permanent. What makes it worse is that these medications are usually taken for years. Their long-term use is rarely questioned, especially when they bring temporary relief. But beneath the surface, they could be straining an already aging cardiovascular system. For seniors, even small imbalances in heart function can lead to big consequences. That's why this surgeon is sounding the alarm now. It's not about scaring people, but about empowering them with truth. Being proactive with medication reviews and heart monitoring can save lives. Always consult your doctor, and never assume that common means harmless. Pill number 7, NSAIDs, ibuprofen, naproxen. NSAIDs are widely used by seniors to relieve pain from arthritis, back issues, or general inflammation. Drugs like ibuprofen and naproxen seem harmless, but they come with hidden cardiovascular risks. They increase blood pressure, cause the body to retain fluids, and strain the heart silently. This combination is especially dangerous for older adults with pre-existing heart conditions. What's worse is that many seniors take NSAIDs daily for chronic pain. Over time, this constant use can lead to heart failure or worsening hypertension. The body becomes overloaded with retained fluid, placing extra pressure on weakened arteries. This can result in swelling, shortness of breath, and reduced exercise capacity. Even over-the-counter NSAIDs carry these risks, not just prescription ones. Because they're easy to access, they're often taken without proper medical supervision. Most seniors don't realize the danger, assuming if it's sold in a pharmacy, it must be safe. But these assumptions can lead to hospital visits or long-term cardiac damage. If pain management is necessary, safer alternatives should be considered. Low-dose therapies or non-drug methods like physical therapy might help reduce dependence. Doctors can also evaluate which medications interact least with heart conditions. Regular checkups and honest conversations about NSAID use are vital for heart health. Pill number 6, thiazolidinediones, e.g., pioglitazone. Commonly prescribed for type 2 diabetes, thiazolidinediones like pioglitazone help regulate blood sugar. However, they often come with a hidden cost: fluid retention that stresses the heart. This can quietly lead to congestive heart failure, especially in aging or vulnerable patients. Seniors with any history of heart disease are particularly at risk and must be closely monitored. The excess fluid makes the heart work harder, leading to fatigue and swelling in the legs or ankles. Breathing difficulties may follow, but patients might attribute this to age or unrelated illness. These warning signs are subtle, yet they can signal a serious cardiovascular complication. Even mild symptoms should not be ignored if this medication is being used. Doctors often prescribe these drugs believing the benefits outweigh the risks. But for seniors, the equation changes. What's manageable in younger adults becomes dangerous later. The aging heart can't handle the same pressure, and the damage builds silently over time. Regular heart function tests should accompany any long-term use of these medications. It's critical to discuss all diabetic treatment options with your healthcare provider. Newer drugs may offer better outcomes with fewer cardiac side effects. Balancing blood sugar shouldn't come at the cost of weakening the heart. Seniors deserve solutions that support their whole body health, not compromise it. Pill number 5, sleeping pills, e.g., zolpidem, diazepam. Sleep disorders are common in older adults, leading many to turn to sedatives for relief. Pills like zolpidem or diazepam may help at first, but they can weaken the heart's responsiveness. They interfere with natural heart rhythms, and slow the body's ability to react during stress. This blunted response can be deadly during nighttime heart events. These drugs also relax throat muscles, which may trigger or worsen sleep apnea. Sleep apnea itself raises blood pressure and increases heart attack risk. Seniors may not realize that the very thing helping them sleep could be harming their heart. Over time, the consequences add up silently and dangerously. Additionally, sleeping pills often interact with other cardiac medications. For example, combining them with beta blockers can further slow the heart rate. This creates a compound risk of bradycardia, low blood pressure, or fainting. One pill taken to rest better may disrupt the entire cardiovascular balance. Safer sleep strategies should be explored first, such as cognitive behavioral therapy or melatonin. Doctors can help assess whether pharmaceutical sleep aids are still appropriate. Especially for seniors, prioritizing heart safety must guide every treatment decision. Sleep is vital, but not at the cost of cardiovascular function. Pill number 4, tricyclic antidepressants, e.g., amitriptyline. Tricyclic antidepressants are older mood stabilizers still used for depression, pain, or anxiety. However, they are known to cause irregular heart rhythms and major blood pressure swings. For seniors, these effects are especially dangerous due to fragile cardiovascular systems. Even small changes in dosage can cause dizziness, falls, or fainting. These medications may also impair coordination and alertness, especially upon standing. The drop in blood pressure when rising, orthostatic hypotension, is a serious concern. Many elderly falls are linked to these sudden changes, often misunderstood as clumsiness. But the true cause may be rooted in outdated prescriptions like tricyclics. More modern antidepressants offer similar mood support with fewer cardiac side effects. Options like SSRIs, selective serotonin reuptake inhibitors, are generally considered safer. It's important that patients and doctors regularly revisit older prescriptions. A treatment that worked 10 years ago might now pose a significant risk. Mental health matters deeply, but so does physical safety. No one should have to trade emotional well-being for heart stability. By modernizing treatment plans, seniors can thrive both mentally and physically. Ask your doctor if your antidepressant is truly the safest choice today. Pill number 3, decongestants, pseudoephedrine, phenylephrine. Decongestants are found in countless over-the-counter cold and allergy medications, but compounds like pseudoephedrine and phenylephrine constrict blood vessels, raising blood pressure. This effect is dangerous for seniors who already have heart conditions or hypertension. One dose can trigger a spike, leading to chest pain or irregular heartbeats. Because they're marketed for minor symptoms like stuffy noses, their risks are underestimated. Seniors might take them repeatedly without realizing their impact on the heart. These medications are particularly risky when combined with blood pressure or heart meds. Their interactions can lead to dangerous cardiovascular overstimulation. Cold and flu season often brings casual use of these pills. But for elderly individuals, even short-term use can be hazardous. There are safer alternatives: saline sprays, antihistamines, or simply rest and hydration. Every medication taken must be considered through the lens of heart safety. Before grabbing anything from the pharmacy shelf, check the label. Look for warnings about high blood pressure or heart disease. What seems like a minor choice today could have major consequences tomorrow. Always involve a doctor or pharmacist in medication decisions, especially as you age. Pill number 2, proton pump inhibitors, PPIs. PPIs like omeprazole are used to treat acid reflux and stomach ulcers. They reduce stomach acid effectively, but long-term use carries hidden risks. They may deplete magnesium levels and disrupt gut bacteria, both vital for heart health. Over time, this creates an environment conducive to heart disease. The link between gut health and heart health is stronger than once believed. An imbalance in the microbiome may increase inflammation throughout the body. Chronic inflammation is a known contributor to arterial plaque and heart attacks. Thus, taking PPIs for too long may indirectly damage your cardiovascular system. Many seniors use PPIs for years without reevaluation. but they were never meant for indefinite use, just short-term relief. Doctors should periodically reassess whether you still need them. Lifestyle changes may offer lasting relief without endangering your heart. Alternatives include dietary adjustments, weight management, or antacids used sparingly. Ask about tapering strategies or gut-supportive probiotics. PPIs have their place, but only when used carefully and consciously. Heart health must remain a priority in any digestive treatment plan. Pill Nr. 1. Calcium channel blockers. Verapamil, diltiazem. Calcium channel blockers are prescribed for high blood pressure and angina. They help relax blood vessels, but they can overly slow the heart in older patients. This can result in fatigue, shortness of breath, and even fainting. In some cases, leg swelling and fluid retention may also occur. These effects can worsen when calcium channel blockers interact with other medications. Elderly patients often take multiple prescriptions, making interactions more likely. This polypharmacy increases the risk of bradycardia and dangerously low heart rates. Sudden dizziness or weakness may be a warning sign of medication overload. Doctors must carefully adjust dosages for aging bodies with slower metabolisms. Regular heart monitoring and blood pressure tracking are essential. Seniors should never adjust these medications without medical guidance. Even a slight dose change can have dramatic effects on heart rhythm. There are often other medications or combination therapies that carry less risk. Discuss symptoms openly and ask about alternatives if side effects appear. Managing heart conditions shouldn't involve compromising overall quality of life. With the right plan, seniors can maintain both heart strength and daily vitality. Your heart deserves more than routine. It deserves attention, protection, and informed choices. Now that you know which pills can silently harm your health, it's time to take back control. Review your medications with your doctor, stay informed, and don't accept normal aging as an excuse. Your vitality after 60 depends on wise decisions, starting with what you put into your body. If you found this video helpful, there's something even more powerful waiting for you. Check the link in the description below to get access to our heart-safe medication guide for seniors. This easy-to-follow material lists risky drugs, safer alternatives, and practical lifestyle tips. It's time to take your health into your own hands, with clarity, confidence, and courage. And don't forget, subscribe to our channel for more life-saving tips tailored to you. We post weekly insights on senior health, longevity, and the truth behind everyday habits. Hit the bell icon to never miss out on a video that could change or save your life. Your heart is strong. Let's keep it that way together.